Welcome back to Learning Pathology with Dr. Bhavana. Now we'll discuss about the chemical properties of urine, first being proteins, next sugars. Proteinuria. Protein in urine is called as proteinuria. The causes are classified into physiological and pathological. Physiological after exercise, pregnancy and orthostatic, which means standing for a long time in upright position. Pathological conditions are classified into pre-renal, renal, post-renal. In pre-renal, the causes are vomiting, severe diarrhea, Addison's disease and fever. Renal, when the kidney is involved, like glomerulonephritis and nephrotic syndrome, where you have massive proteinuria. Post-renal, lesions of the prostate and urethra. What are the tests for proteinuria? We can classify them into qualitative and quantitative. Qualitative, heat coagulation, Heller's nitric acid and sulfosalicylic acid, where we can grade the proteinuria. Quantitative tests, whether proteins are present or absent. Eschbach's albinometer tests. Other tests are the protein reagent strip method, biuret test and electrophoresis for urine proteins. The first one will be asked in detail. It is called as the heat coagulation test, where 3/4 of the test tube is taken with urine sample. You have to heat it. Only the lower part acts as the control. The upper part is heated. This is the most frequently asked question by the examiner. Why? The upper part only is heated. So you have to tell that the lower part acts as control. When proteins are present, they get precipitated. So now the next question will be, how do you differentiate whether the precipitate is because of proteins or not? Once you add 1% glacial acetic acid, if there is persistence of the precipitate, then it is due to proteins. After adding glacial acetic acid, if the precipitate dissolves, it is because of sulfates and phosphates. We can grade it by the heat coagulation test. When there is no precipitate, absence of proteins. When there are traces, you have a hazy precipitate. When it is less than 10 milligram per deciliter. Cloudy, you grade it as 1 plus. 10 to 50 milligram per deciliter. Granular, 2 plus. 50 to 200 milligram per deciliter. Flocculent, it is 3 plus, where it is 200 to 500 milligram per deciliter. And thick cloudy, you grade it as 4 plus, where the protein will be more than 500 milligram per deciliter. The same one in a tabulated form. Absence, traces, 1 plus, 2 plus, 3 plus, 4 plus. The range of proteinuria usually is less than 150 milligram per 24-hour sample. When it is less than 500, you call it as mild. Moderate, it is up to 4 gram per day. Heavy proteinuria or massive proteinuria when it is more than 4 grams per day. Next frequently asked question is Benz-Jones proteins. What are these proteins? These are the low molecular weight globulins which contain kappa or lambda light chains of immunoglobulin, usually seen in plasma cell disorders like multiple myeloma or plasmacytoma and Waldenström macroglobulinemia. How do you differentiate the Benz-Jones proteins on the simple heat coagulation test? On heating urine to 40 to 60 degrees centigrade, the white coagulum is formed, which usually dissolves on further heating. But these Benz-Jones protein, they precipitate and reappear when the urine sample is cooled. That is how you differentiate the Benz-Jones proteins on heat coagulation test. You also measure the Benz-Jones proteins by electrophoresis, where you have homogeneous band of the protein. Next asked question, what do you mean by microalbuminuria? When there is persistent elevation of albumin, you call it as microalbuminuria, where the value is ranging from 20 to 200 milligram per liter. So there is a probability of damage to the glomerular filtration capacity. So it is of great diagnostic relevance, especially for the early diagnosis of patients of diabetic nephropathy or hypertension, or those patients who are developing preeclampsia. So you can be assaying them by immunometric assay, nephelometric assay. What do you mean by selective proteinuria? When there is selective excretion of low molecular weight proteins like albumin or transferrin through the kidney, it is called as selective proteinuria. What is poorly selective? When high molecular weight proteins are excreted along with albumin, it is called as poorly selective proteinuria. Now, what are the causes of selective proteinuria? Minimal change glomerulonephritis, focal segmental glomerulonephritis, and membranous glomerulonephritis. Thank you. So, this ends our discussion about proteinuria. The next session will be about glucose in urine or glycosuria.